When your ventricles contract, that creates your pulse. That's what you get on a pulse on a monitor. Now, in normal rhythm, they're following the atrium. This little deflection we see, that's the atrial signal. On the surface EKG or monitor tip, that's the big signal as the ventricles. So the atrium followed by the ventricle. In atrial fibrillation, the atria have lost their signal. The sinus node is no longer generating a normal signal. Signals are coming from multiple different parts of the atrium at the same time. And that's the basic reason why atrial fibrillation is difficult to treat and deal with, because there isn't one single spot in the atrium that's abnormal in atrial fibrillation. These little areas of abnormal activity run around the atrium in different areas continually. The other good thing about this diagram actually is it shows anatomically where the pulmonary veins are. So there are the holes of those tubes that are bringing back to the lungs. And it turns out that of those pathways, actually most of them are grouped around where the pulmonary veins meet the atrium in atrial fibrillation. Again, thankfully the AV node gatekeeps here for us. So your main pump chamber, the ventricles, are protected from all these rapid rates. But obviously some of these beats get down to the ventricle. So the ventricle speeds up compared to normal rhythm, and it's irregular. Okay? This then, in between, as I showed you at the very start, this is what the atrial fibrillation looks like on the surface EKG. The manifestation of all those little individual circuits running around on the EKG looks almost like just a shake or a quiver on the surface. So electrically, the atrium is probably going somewhere around 300 to 400 beats per minute. It's really just quivering, but electrically you can measure rates in it that fast. Again, the AV node protects our ventricles, so only about a quarter or a third of those beats go down, and the main pump runs at about 100 or so in atrial fibrillation. So that's the normal, and that's what happens in atrial fibrillation. So when that heart loses its rhythm, the atrium sort of flutters or quivers. It's not properly contracting, and it loses that little booster pump function it gives us. And also now our ventricles are not getting the right timing signal. They expect it to come from above, but they're getting lots of chaotic signals. So we lose two things. We lose a little booster pump, and we lose the regular beat of our hearts. A lot of people have atrial fibrillation, and in a moment it'll become clearer why. But at the moment, it's estimated about 5 million people in this country have atrial fibrillation. And actually, at age 40, unfortunately, you have a potentially up to 25% risk of developing atrial fibrillation in your lifetime. So it's a really common problem. It's also a major impact on quality of life. So once you lose that normal rhythm, you run into issues with your functional capacity, just not being able to do as much physically because you've lost some rhythm and booster pump function. Treatment is costly, certainly, and we'll see that tonight, and there are side effect issues. And also there are certainly emotional and psychological issues, and many of our people who have episodes of tachycardia are, even though they're not very frequent, just are afraid to travel and do things, and it just limits life. The other issue with atrial fibrillation, there are two main risks in the long term to atrial fibrillation. It's not a life-threatening problem by any means. It's not the ventricle. It's very important we distinguish atrial fibrillation from ventricular fibrillation, which is cardiac arrest, and it's a completely different scenario. The atrial fibrillation is a loss of rhythm that leaves two serious possible consequences. One is little blood clots can form in the atrium because they're no longer squeezing properly, and their blood can pool there, cause a clot, which if it forms is very small and actually doesn't cause a problem in the heart, but if it goes into circulation, causes a stroke. So probably the most important thing about atrial fibrillation is protection against blood clot and risk of stroke. A thing that's a little less well known about atrial fibrillation, but atrial fibrillation is a cause of congestive heart failure for some people over time, probably because of just the heart running for too fast, unnecessarily for too long. So over time, those are big risks of atrial fibrillation.